Okay.
All right. What are some uses of Oriental medicine?
Some of the uses of it?
Mm-hmm.
Well, Oriental medicine, bear in mind that it's a very broad medical paradigm, and most people tend to think of it in very narrow and specific terms, mostly for pain management or something like that. But like I said, bear in mind it's a very broad medical paradigm, and because of the theory behind the medicine, because of the way we frame a particular problem when a practitioner looks at it, it allows us to treat a wide variety of different diseases and conditions. And when I say a wide variety, I mean a wide variety. The only thing that I often tell my patients when they call asking about does Oriental medicine treat this or does it treat that, I say, whoa. The only thing we don't do is surgery and prescribe drugs. That makes it everything fair game, okay? And that's because of the way in which we frame a particular disease or condition when we have to look at it.
All right. What are some advantages of Oriental medicine?
Well, the advantages is that, number one, we don't prescribe drugs, we don't do surgery. So iatrogenic causes, and you know what that is, right? It's very low. There's very little downsides to the use of Oriental medicine. And what I typically tell my patients is that it's probably the most forgiving therapy available today, because I can't think of any real side effects that that can arise from applying the different modalities of Oriental medicine.
All right. Are there any disadvantages of Oriental medicine?
The disadvantage is that we don't do surgery and we don't prescribe drugs. And even though we can treat a wide variety of conditions and diseases, there are times when Oriental medicine as an alternative is not an alternative. If you need surgery, you need surgery. If you need pharmaceuticals or drugs, you need it. There is no way around it. So that's it. And that presents a disadvantage. The other big disadvantage I find is the fact that the general public at large is ignorant about the scope and of this paradigm and what it can actually do. And that ignorance is shared by the public and by the general medical establishment at large. So that creates a disadvantage.